Well, good morning, everyone, and welcome. Thank you for joining us this morning here at the Greater Reston Chamber of Commerce. My name is Charles Kapoor, President and CEO here at the Greater Reston Chamber, and very proud to kick off and introduce everyone here to the start of our latest offering in the Chamber's legislative series. Our presentation today, Getting Back to Work, Prepping Your Office, Your Workforce, and Yourself. Today's webinar is being produced in conjunction with the Chamber's Public Policy Committee, led by our fabulous co-chairs, Mark Looney of Cooley LLP and Joey Musmar of Miller Musmar CPAs, who we'll actually hear from in just a little bit. And as everyone gets settled in, I'd like to take a moment and recognize the businesses that are supporters of the Chamber throughout the year in the form of their annual sponsorships. And here you can see the organizations that serve as our annual strategic sponsors. Thank you so much to these great organizations. Our visionary sponsors, thank you as well. And finally, our advocate annual sponsors. Thank you so much to all of the businesses that serve in all of our various levels of annual sponsorships. They help the Greater Reston Chamber put forth all of the programming and events that we do throughout the year to serve our business community. So we're very proud of those partnerships. And specifically, I'd like to also recognize those businesses that have helped support this legislative series itself, our series of programming that we put out throughout the year. Thank you so much to the team at Miller Musmar CPAs, McGuire Woods, Reed Smith, Sandy Spring Bank, and Walsh Colucci, Lubley and Walsh. Thank you so much for those businesses for your support of the legislative series. Items. So without further ado, I'd like to introduce our moderator for today's discussion, Joey Musmar, owner of Miller Musmar CPA, and the co-chair of our Public Policy Committee, to introduce our panelists. Joey, please.
Thank you so much, Charles, and welcome everybody. We've put together an amazing panel of experts that really I think you guys are going to enjoy listening to and hopefully getting a lot of advice on how to get back to business, get your staff back to work in a safe and productive manner. And I'm going to introduce the panelists, and we're going to be basically going through and having each of them speak to give you their unique perspective on what's going on. And we really welcome a lot of the Q&As that you have. I've already prepared a lot of questions for the panelists, but our goal right now is to make sure you as the attendee can ask your questions to these experts. So starting off with Christine Wood. Christine is the Director of Human Resources at Leidos, and she's going to speak to the logistics of returning to the office setting and back to work. Dr. Donald Koziak, he's the Chief Medical Officer also at Leidos, and he's going to speak about mental wellness aspect of the employees. And obviously, since he's an MD, he can talk about literally this virus and how it works and interacts with individuals. So please even ask questions about that. And then we have Harry Claff. He's the Managing Director of JLL, Jones Lang LaSalle, and he's going to speak about the tenant perspective and how they as a company are helping all their tenants to set up a proper and unique space that is going to comply with all of the regulations that are out there to help you have a safe workspace. So Harry, let's start out with you and have you give us your perspective on what's going on, and then we'll go with Dr. Koziak next. Harry?
Great, thank you, Joey, and thank you, Charles, also. For many of you who are attending, you may have already seen something like this, or even this very presentation. I know we have some clients on the phone today that have seen this. We've been doing navigating COVID on behalf of our clients, which includes Leidos, and for the past 75 days or so. And we are breaking ice with everybody else as we're learning what we need to do at the same time and disseminating that information across the globe. Fortunately, we've got the benefit of having a very significant presence in Asia, in Europe, and they're at least 30 days to 60 days ahead of us. And we've got best practices that have been able to been learned from their experiences, and we're passing those on to our clients as well. So next slide. We, about 60 days ago, did a survey, and we surveyed 180 occupiers globally regarding their response to COVID and how they were working, how they found themselves working during this remote working period. And as you might imagine, the big issues were transportation. In most very large cities internationally, our clients were very concerned about transportation, especially public transit. That's still the case. And if you just look at the transit numbers right now, they're substantially down. You would expect them to be. I think until there's a therapy or a vaccine, public transportation is probably going to take a substantial hit, which impacts, obviously, work from home policies. Working from home, there's no question that, most of you on this call and most of the folks we talk to on a day-to-day basis have found it to be better than expected. Productivity has been better than anticipated, both from employer and employee perspective. Before this call, we were just chatting about the fact that that is not universal, however, and it's really a byproduct of what kind of technology your area has, what kind of technology your household has, and what you can support. So productivity, while it has been better than anticipated, probably isn't as good as being in the office. And that has had some impact, which I think will be measurable months from now as organizations figure out kind of where their productivity hits may have been. From a savings perspective, there's no question that employees especially have saved money during this period. If you take transportation to work, you drive to work, you're saving on fuel. Clearly, there are fewer lunches or breakfasts out, so consequently, they're saving. But we're also heard from our participants that coming to the office is important. It's important from a socialization perspective, collaboration, innovation. Hard to do via Zoom calls. It's not bad, but it lacks the face-to-face interaction that I think drives innovation and social fulfillment. So we are, as we've talked to all of our clients over the course of the last 60 to 75 days, we have it's changed dramatically, but their attitudes towards remote working have changed also. At first it was, and Jack Dorsey from Twitter said, hey, if you want to work from home till the end of the year, you can. That was kind of misconstrued, but it was certainly, people took note of it, given the fact that it's a substantial company with a big real estate footprint where leadership basically said, if you feel more comfortable working from home, do so. Our expectation is that as it becomes safer to work in the office, a lot of people will go back, and I do believe that there'll be a pull back to the office. But there's absolute certainty that there'll be more remote working going forward, and that'll be built into workplace plans. Next slide. So when we first started working from home, call that early to mid-March for most of us, I think there was shock and denial and disbelief, and I, for one, was one who was as shocked and disbelief as anybody. But after a while, there was a realization that this is the new normal, at least for now, and that we all responded and did what we had to do to make ourselves as productive as we possibly could working from home. We see ourselves right now at the bottom of that U-curve, and we're on our way up as companies as companies are starting to plan for reentry, and some have already reentered the workplace. And in fact, I know companies like Leidos have had folks working through this entire period of time. We will see a flow of folks back to the workplace, and we ourselves at JLL are planning to re-enter the workplace in about a week with our first phase, and our second phase will follow based on governmental guidance. We're spending a lot of time right now at the top of the U-curve talking about reimagining the workplace and thinking about what the future looks like and how remote working is going to be incorporated. What happens if we're a year out or even 2 years out from a vaccine and there's spikes in the future? What do we do to make sure the workplace is is as safe as possible for our employees. So that's also a focus. Next slide, Alicia. We've done a series recently called A Day in the Life, and this is what we've been spending a lot of time on recently, dealing with potential anxiety and frustration of employees. And it's probably not going to come as a surprise to anybody on this call that there's a high level of anxiety and potentially a high level of frustration at any time that there might be a choke point or there's a lot of public interaction. So at the point where if you're in a multi-story office tower, for instance, and you're queuing for an elevator and you're congregating in the lobby, obviously significant anxiety and frustration. So landlords are being charged with figuring out the queuing efforts associated with getting people into elevators and into their office space. Same thing would apply for lunch. If people are leaving the office to go find a place to get takeout, and also at the end of the day. So those periods of the day where there's anxiety and potential frustration is the issue that employers are going to have to manage around, and landlords are going to have to manage around too for multi-tenant buildings. We're spending a lot of time working on policies associated with that. Singapore, which opened about 30 days ago, has significant office towers, and our facilities management folks have told us that some of the queuing at the very beginning was taking 2 hours to get people into and through lobbies and into elevators. So they've moved to a reservation system for how they enter buildings, and it makes complete sense. So there are waves of people that occupy at specific times. The queuing has improved, and that level of frustration and anxiety is also improved. Next, please, Alicia. This is your typical office. I'm just going to touch on a couple of these, and many of you probably have thought about many of these items that are on here. One of the big issues is screening. Are you going to do temperature screening or any other type of testing for access? I'm sure Christine and Dr. Koziak can talk about some of the benefits and potential drawbacks of that issue. Well-being, elements such as HVAC maintenance, changing the MERV rating on your HVAC filtration, fresh air intake, all of those things that would be necessary to keep your space safer. Mobility standards, obviously a critical component. Janitorial, enhanced cleaning, especially daily cleaning of areas that might have a lot of touch, for instance, restroom facilities, or maybe if there's a break room. Reconfiguring your meeting spaces is a critical component, and obviously the occupancy of the space itself to provide for social distancing is something we've been spending a lot of time on with our facilities management folks and also with architects. Next slide, Alicia. This is just an example and an illustration of a few things, but I do want to point out, basically the two on the bottom are our workplace and meeting rooms. You'll notice that there's substantially less density than there was before. So an 8-person conference room right now might be a logical location for 4. Common areas such as lobbies and how people access passive travel are going to be provided. And then if there's a testing station, how that's implemented. One of the things that I really want to stress is about communication, especially as you welcome your workers back. It should be done in a thoughtful way with a lot of guidance and policies associated with this, so you're protecting everyone. We're spending a ton of time writing that policy and also creating the signage that would go into office buildings and office spaces to keep people safe. Next. As for JLL, we are practicing what we preach, and we're in the process of re-entering our offices in the Mid-Atlantic. We're going to start with about 10 to 12%. We're going to be going back in about a week or so, but we're going to make sure we're very careful. If our employees do not feel comfortable, they can work from home. We'll be making sure that we stagger the occupancy. So for instance, you'll be a week on, a week off, and it'll be reservation only. can't drop into the office. You can't use a conference room whenever you want to. It's going to be very controlled as the restrictions are lifted, and by the government and health authorities. We'll increase that density, but that'll be over the course of time. We're not in a huge rush to do this. We want to make sure that our folks are as safe as possible. So understand we're in the same boat as all of you, and we have to do it right because we consider ourselves to be leaders in this industry, and we want to make sure that we're leading appropriately. Next. That's it for me. Joey, you're on mute. Joey, you're on mute.
My mistake. I apologize. Thank you so much, Harry. Great presentation. Now we'll move on to Dr. Koziak, if you can. Dr. Koziak, let's go ahead and get your coverage, since you are the Chief Medical Officer, about health and wellness.
Sure. Well, thanks, and thanks for joining us, everyone. Getting up early and dedicating some time to learn about coming back to work. Isn't that fun? My name is Don Koziak. I am the Chief Medical Officer at Leidos. I'm an emergency medicine physician. I've spent the last decade or so in sort of the health IT administrative work. My first decade or so of my career was around disaster preparedness and emergency services. So it well prepared me for a pandemic response for a corporation with 37,000 employees. What I'd like to talk about today through the question and answer period are things that are probably on your mind about how to get back to work. So I believe we're going to talk a little bit about testing and what does the various testing mean, and how reliable is that for your coworkers and your HR team to rely on that testing to do something different. We may talk about some of the screening that you're going to face coming through and why we're doing some of those screening, and what's, again, the reality of, will it pick up people that are sick? And then we may talk a little bit about face masks and face shields. And then alternatively, those who can't wear a face mask for whatever reason, what is the solution for them? And then lastly, I think we'll spend some time talking about what is the risk in the workforce, and how do you keep yourself mentally and physically well when you're in the workforce. Again, for all those reasons that we used to go to work for social escape, and now we're told that when we're at work, we can certainly wave at people, but we shouldn't have long conversations by the water cooler for lots of different reasons. So I'm happy to continue to go further, but because we're doing a panel discussion, we'll have some of that come up. So Joey, I don't have anything else unless you want me to dive into any of those topics right now.
One of the questions I wanted to ask Dr. Koziak is regarding the pandemic itself. You know, one of the things that a lot of people are concerned about is how do you explain internally, like when you're inside an office, why we have to go through all these procedures, and what are the typical procedures that you'd recommend people do to stay healthy? Sure.
Well, for the pandemic itself, so this virus, this coronavirus that we all have come to know and hate, is what we call a novel virus. So it's something that the human body had never seen before. We had like coronaviruses. Some of them were very mild, like the common cold, and other coronaviruses caused big trouble, like that was floating through the Middle East for a while on the initial SARS virus in the early 2000s that really wreaked havoc in Asia. And those viruses, when they're novel, it means that the immune system of the entirety of the human population has never seen it before and doesn't know how to respond to it, which is why you see the reaction that we did, lots of sick people, and why we wanted to do things differently. So why did we hammer the economy down or stop things from happening? Well, it wasn't to prevent or die out the virus. It wasn't going to go away by doing that, but it was certainly going to slow down the pace of transmission. And the goal was having enough hospital beds and providers available to treat those that were sick. So the first misconception I get is because we locked down, the virus should just go away. Sort of. It will still be dwelling in the background because the only way to make it go away is if everyone physically stopped moving for 14 days, you'd get it to die out. That's not, of course, possible.
Yeah, good luck with that.
So then the next option is if I can flatten the curve, that phrase that we kept hearing about, if I can spread out the number of people infected from having it all happen in a month to have it over 6 or 8 months, I'll have enough hospital beds available to care for those that are sick. I have time to figure out if there's better treatment options, which we're doing now. And you're hearing about lots of different treatment options now. And you have time to maybe come up with a vaccine that will help others from getting sick. So that's the reason that we flatten the curve. And we've done a fairly decent job of that across the country, even in places that were hot spots like New York City. Maybe they got into the flattening of the curve a little bit slower, not on purpose, just that was where the viral load started in the United States outside of Washington, right? You still saw a decrease in the number of affected because everybody's sheltered in place. And that played out across the country as they got more aggressive with that shelter in place. So now we all want to come back to work. And all the states are lifting these lockdown orders. And so what should I be looking for when I come back to work? And the thing is that the work is no different than your safety at Walmart or Target or going to the grocery store. You still relatively are going to get in your safe car and you're going to drive to your safe parking spot and you're going to walk into the building, and there you may face your first changes, as we saw on the slide deck. You may face a questionnaire if you haven't already done that before. You may see a temperature check as you go into the building. You'll certainly hear in lots of places about wearing a face mask or a face shield as you walk through the building, particularly in the common spaces. And you'll see that the workforce is spread out. And there'll be some deliberate markings of places that you shouldn't sit or can't sit for lots of different reasons. But other than that, you're going to see a very typical workplace. And your day, for the most part, isn't going to change all that much other than when you go into those common spaces. You'll still likely, even though you're at work, still use Zoom, Skype, Microsoft Teams to have big group meetings because you can't fit big groups into the space. I would say, so I'm gonna stop there and see if there's additional questions, but I'd like to talk about social distancing a little bit when we go to the next level.
No worries. I mean, for me on the medical side, when you look at, you talked about masks, but for example, you didn't talk about gloves.
Sure.
We see individuals coming in and they insist on wearing gloves. What are the pros and cons for wearing gloves from a medical perspective and protection?
Sure. So the reason that gloves came into popularity in the healthcare field in the 80s and 90s was because of HIV. HIV is a blood-borne disease. So if you get blood on yourself or into yourself, it can cause the virus. And so it was a way to protect yourself from having to have that blood-borne pathogens on your skin and hands. It also helps with high-risk procedures, like droplet procedures or aerosolized procedures, where you might get viruses on your body in large quantities. For the average user, gloves don't add a great deal of benefit, particularly if you're practicing all those other things. So again, coronavirus is a droplet disease, meaning that the virus rides on the little bit of water that we have in our breath. And if you live in a cold place and you've ever taken a breath outside or exhaled outside and you see that mist, that's happening every single time we breathe, whether or not it's warm or cold. We just happen to see it when it's cold.
Yep.
And so that breathing is where the virus comes out of our body. Generally, that vapor falls straight to the floor. Sometimes in different situations, it may hang there for an undefined period of time. And when it falls to the ground, the virus generally will die off in a certain period. We've heard stories of it living for 9 days, and all those things are in a lab, right? So I always warn you, in the wild, things act differently. Just like when you get your new computer, they tell you that your battery is going to last 12 hours, and then you use it and it lasts like an hour and a half.
Yeah.
Same thing. So when I test things in an ideal situation, I'm there. So to the gloves are great, but the virus itself isn't bloodborne, and it doesn't go through your skin. So if the virus lands on my hands, it doesn't actually absorb through my skin. The only way I get it in is if I touch my face or my eyes. And so if you don't if you're constantly using the gloves and then you're not washing your hands throughout the day, you're increasing the risk for everyone else because you might have that fomite on your gloves. if you don't know how to properly take off and put on gloves, you're also causing risk to yourself by putting on and off gloves. So because it doesn't absorb through your skin, if you have to touch a doorknob or push an elevator button, the easiest thing to do is wash your hands after doing that event. And then you won't have to worry about whether or not I'm taking off the gloves right, or whether or not I've had them on for 6 hours and therefore I've touched everything and I may have viruses on those gloves that I've spread everywhere. So it gives you that false sense of security.
How often do you think you need to wash your hands if you're at the office? Is this, something you do once a day, twice a day? What do you think?
So the answer depends. I would wash my hands, and I do anytime I go into common areas or out in the public. You're very cognizant about what you're touching and where you're going. And then if you do have to touch something, it's really easy. Almost everywhere you'll find some hand sanitizer or a sink where you can go in and just wash your hands. Use the paper towel if you want, or a tissue or some cloth item to touch those things and open the door and then dispose of them is an easy way to get around common areas. Now, most buildings, I'd imagine, just are trying to open up as many doors as they can. So it becomes much of a touch-free environment. And those handy capable buttons that we've had on walls for a long time to open doors, you can use to bump with your elbow and it will open the door for you. And isn't that great that you don't have to touch anything? So there's other things you can use.
Used all over the place when people are walking to get the crosswalk to work also.
Correct. Correct. So there's ways that you can have a no touch or low touch environment without having to wear gloves.
And washing wise, again, 20-second rule is what works out.
Yeah, so 20 seconds, they have all sorts of ways to sing happy birthday to yourself, but really if you're just putting on some warm water and some soap and you count backwards from 20, it's really easy. Vigorous scrubbing is actually what makes the soap bubbles break down the lipid barrier of the virus. And rinse your hands, wash with a paper towel or rinse with a paper towel. You can use the paper towel to open the bathroom door, throw it all away in the garbage can, and while you're safe and clean.
So one last question. In some bathrooms, I noticed they have the hand air dryers. I'm assuming we stay far away from those, or what is your take on it?
Yeah, so hand air dryers, even before COVID, were known to make your hands dirty because of the bacteria and viruses that people are washing their hands, and then because it blows, it gets up into that filter, and so that they're less than ideal. If that's all you have, certainly that's a great tool to use. However, if you have paper towel available to you, that's the best way to wipe it and throw it so you know that you've gotten rid of any residual dirt. And remember, every day we have viruses and bacteria on our hands. It's not new, it's not something unique to COVID. Some of the bacteria is very healthy for us, some of it's not. Some of the viruses can be advantageous to us and others aren't. And so know that you're not doing anything unique by washing your hands and throwing it away today, as opposed to 9 months ago when nobody had ever heard of COVID.
How about the mental toll of the pandemic and how it's affecting workforces? I mean, it's got to have an impact on everybody. What have you seen, and what can you tell us about that?
Sure. Well, so we're probably just as connected as we've ever been, and still as lonely as we've ever been. And that was before the pandemic and during the pandemic. Because of the way that we interact, we spend more time on email and sending text messages than we do about physically talking to people, which is the connection that a lot of people need. And it's been that way, where we've been wired that way for very, very long to have social interaction. So not only then are you taking that social interaction away from people that have been used to it, you're adding all these rules about how to go out into the world and how to go to the grocery store. And you have this constant anxiety about, could I get the virus? And if I get it, maybe I'm going to be healthy. What if I gave it to somebody else and they had a bad outcome? And so these are the things that people are worried about when they're coming back to work and inward. And then, if I've been at home and I've been following the rules and I'm in lockdown, really only the people I've been exposed to for the last 3 or 4 months are my family members. And we know they've been very careful and we follow all the rules. But now you're asking me to go to this work environment where I don't know if all these people are following the rules. And if I wear a mask and I'm diligent about washing my hands, I'm doing a really good job protecting myself. But what if they're not? What if they, went out to the bar last night with 500 other people, and now they're coming to work and they decided washing your hands is stupid and they're touching everything. And although they sort of wear a mask, they don't put it on. And so then are they causing me more harm than good? The answer is
My
maybe.
favorite is the partial mask on with people where they cover their nose or their mouth, but they never cover both. So
Yeah, so public service announcement, if you're going to wear a mask, you need to cover both your mouth and your nose. Ideally, it would be a tight fitting. That's the reason that it works. Again, droplets come out. So if you have a low fitting mask below your nose, when you breathe, you're still putting out exhaust. Again, remember, if you're outside in a cold weather and you breathe out your nose, you still see the fog.
exactly.
And if I sneeze, I'm going to send that there. If I have over both my mouth and nose and I cough or sneeze, it's going to stay contained into this place. So mouth and nose both, please, people. If you're going to wear a mask, do it. That does come to the, what happens if for whatever reason I have a medical condition, I'm allergic to cloth, what can I do in exchange of wearing a face mask? We get those questions sometimes. And people have talked about this face shield. You'll see like a clear plexiglass or plastic face shield. And that actually does a fairly good job of protecting you, again, from inhaling the virus or touching your face or those things. A little less protection about protecting everybody else because it's not close up to your face. There's still some gaps around it, but it's a better alternative than not doing anything. And so in the healthcare field, you'll see a combination of mask wearing and face shield. They're synergistic, much like a lap belt and a shoulder belt in a car are synergistic. And that you're not supposed to wear the shoulder belt without the lap belt because of that. So the face shield is like the shoulder belt, adds lots of protection, but you should have a lap belt on too. So when you can't, having that face shield on is okay, but you want to make sure that it covers your whole face. So all the way down below your chin, wrapped around towards your ears. So again, if you happen to have some exhaust come out, it's captured into the face shield itself. And then if you're having people that are next to you that aren't wearing masks, you still get that protection of covering those vectors.
Well, I like the
benefit of the face shield in addition is that the eye is a vector. So your mucous membranes of your eye are actually a vector to get virus into you. So you obviously wearing a face shield, you get that added protection.
No, excellent, excellent. Well, thank you so much, Dr. Koziak. Let's move on to Christine Wood. Christine, can you tell us a little bit more about what you guys are doing at Leidos to help your staff get back to work? And we can go from there.
Absolutely, Joey. So thank you. And I learned a lot from you, Dr. Koziak, I didn't know about, so I appreciate your insight as well. So I'm really honored to be talking to you all today about such an important and timely topic, which I know is really overwhelming when we think about bringing people back into the workplace. So not just for companies, but managers and employees and all the different things you have to take into account when you consider bringing them back. So I hope some of the things I share with you today give you some additional insight. So as you can imagine, when we think about the logistics of bringing people back into the workplace, it requires a lot of planning and forethought. So very early on, Leidos formed a COVID working group, and I'm a participant on that working group. And we have representation across the business, so we get a variety of input. And we meet regularly and talk about overall guidance to provide to employees and managers, as well as just reviewing and addressing the various concerns that are out there. This is new for everybody, right? And I know Harry touched on the importance of communication. That has been at the forefront of everything that we do. It's so instrumental. You can imagine the lack of communication that provides stress in a normal environment when people don't feel like they know what's going on. So compound it in this environment, and we can see the terrible impacts if we don't keep people informed constantly. So I'll highlight some of the things that we're doing at Leidos and maybe some of the things you all are seeing out in your companies as well. After developing the COVID-19 working group, we also designed a dedicated pandemic website. So we have a lot of information posted out there for our employees, a lot of resources, different tools, frequently asked questions as well. We have weekly videos from our CEO to provide employees with an update on how Leidos is responding to the pandemic. We have regularly dedicated briefings for our managers so they can get an opportunity to ask questions and figure out how they should respond to questions and concerns from their employees as well. We've given training materials to our managers to help address some of the different issues. We recently issued a survey as well to our US population to hear how they think Leidos has responded to the pandemic. How have we handled it? What could we do differently? How do they feel communication has been? And we're just starting to see the results of that recently closed, and overwhelmingly positive feedback. But you can always take things from surveys, and it gives us an opportunity to shape future actions over the next coming weeks and months. So I imagine some of you are seeing some of those similar actions. So with an abundance of caution, we are taking a phased-in approach to bring people back into Leidos facilities. So we'll do this with a really thoughtful manner, and at the forefront has to be the health and safety of our employees. So this return will be based on operational need as required. So we're not obviously bringing everybody back, and I'll talk a little bit more about what that phased approach looks like. And we recognize it can be different at various facilities, right? We have people all over the country, we have people internationally. So we have to recognize it isn't a one-size-fits-all approach, and really have to arm our leaders to help through this process. So those first line leaders who are managing the employees really take a key role in the process. They know who are the most critical employees to start bringing back into the workplace. And then we have a more targeted team, a smaller working group that actually came up with a pandemic playbook for our managers and our facilities teams to work through making sure we have a consistent approach across the business, and of course that we ensure compliance as well. So we have spacing guidelines in that book, talking about appropriate signage, how we handle cubicles, making sure we have plexiglass installed, a variety of other factors that we touch on. And it's become a real key for our leaders to look to understand what their role is, the expectations, and how they address issues with employees.
You brought up cubicles, which I think is a good point to ask a question. Somebody was asking questions about how do you protect small cubicles, or I think that what they were trying to say is, cubicles with no walls, because everybody, that's what's in vogue now, is this open space environment. So what are you doing at Leidos to address that?
Yeah, that is one of the biggest concerns, right? Because if you go into your office, you're social distancing, so you're rather safe. And even in our conference rooms, as Harry touched on earlier, you may have 50% of people there. So social distancing is a lot easier. We have a very open environment in some places where cubicles are really close together. So we are not bringing people back into those places until we have high plexiglass installed in between. So if we happen to have individuals in side-by-side cubicles, we have that plexiglass there to separate them. But as we go through that phased-in approach, we're not going to be bringing a large percentage of employees back into the workplace at one time. So we want to, initially at least, avoid that side-by-side, even with the plexiglass if possible.
So combination of physical distancing and literal barriers to protect the staff.
Exactly.
Okay,
Yep.
Excellent. Excellent.
Yeah.
Go ahead, continue, Christina. I just wanted to
Sure.
ask
Yeah, no problem. It was a good question. So some of the key aspects you need to think about as you plan that specific direction on workplace reoccupancy is, what are those key factors? So face covering guidance by area. When and where do employees need to wear face coverings? It's not just coming into a building. It's the elevator. It's all common areas. So you have to think about conference rooms, break rooms, stairwells, kitchen areas, hallways, basically everywhere that you're not going to be able to guarantee social distancing. So you really have to think about the spacing guidelines and have appropriate signage for that. And there's a lot of coordination that has to go into it, right? There's so much involvement for various functions within a corporation. You've got your facilities team, security, environmental health and safety, human resources, managers, et cetera. And we also have to think about cleaning, right? Cleaning and sanitizing. So another point Harry touched on earlier too was enhanced cleaning. So we recognize that, we've had cases, as most companies have, where there's, positive cases, presumed positive cases, et cetera. And how do we manage that? So we have to recognize that not only are we stepping up our regular cleaning, but how are we all handling those cases where we have enhanced cleaning as necessary?
So how do you determine what level of enhanced cleaning you need to have? If I have an office and I have a conference room and I'm having meetings with multiple clients in it throughout the day, what protocol would you guys recommend someone to implement?
So we obviously are having supplies at each location. So in those conference rooms, there's hand sanitizer, there's cleaning, there's wipes provided, et cetera. And we also encourage individuals that are going to common spaces to wipe down before use and after use as well. So it's a combined effort. But in areas such as, I'll use proposal rooms, there's a lot of activity that goes on in proposal rooms, and sometimes social distancing is a challenge. So we need to make sure in those places where we know there's a high volume of activity, or there's, you know, high degree of people, that we have them cleaned more often. And we work closely with our facilities team so we can make certain that we're requesting that. Or if we do have a case where an individual was in an office that found out they were presumed positive, we immediately coordinate with facilities to make sure that that area is completely evacuated and it's thoroughly cleaned before anyone is brought back in.
Let's assume we have someone that has a laissez-faire attitude towards this whole thing. You know, they are saying this is overblown. My God, I don't want to wear a mask when I'm at the office.
Right.
I'm just going to walk around, you know, really ignoring some of these guidelines because I don't really think this is really that dangerous. How would you want someone to address that? Because you're going to face it 1 in 100 people maybe, but I think that it'll be there.
Oh, absolutely. People are going to be resistant, right? You're going to have both ends of the spectrum. And we hope that employees are comfortable if they see someone walking around in a common area, for example, without a mask, to remind them, right? Some people are just going to forget. It's human nature. If you haven't been back into the workplace, when you initially go back, it's going to be a little bit of culture shock, and you're not going to be used to wearing the mask. You're going to be, if you're in an office especially, remembering to put it on every time you leave. So sometimes those gentle reminders are going to help. But then you're going to have people that are truly going to resist it and say, I don't like wearing a mask. I'm not going to wear a mask. And then that's when you really need to involve management or human resources. We're here to help, and we don't want to put employees in an uncomfortable situation to address it. But we are arming our employee population with guidelines to understand what those expectations are. The signage is going to be there as reminders, and then we hope there's those verbal reminders. But if we do have people that refuse, regardless of all of those things, then that's a human resources issue to address.
Okay, and basically I'm assuming human resources will say, why don't you work from home?
Along with some other guidance, yes.
Yeah.
Right.
You know, some of the interesting part is we've seen some of the stores or locations, they literally, if you don't have a mask, they give you one because some people literally forgot and they're not used to the habit. And that's what I think is going to be the hardest part, is reminding people as they step out of their office and they go from private area to common area that they got to put on the mask. And how we can go about doing that. I think it's going to be an interesting psychological pivot that everybody's going to have to make
Absolutely.
that happen, you know?
And so, you know, part of our framework in addressing this reoccupancy is going to be reminding those employees of their responsibilities. One of those is bringing a facial covering to work every day, but we recognize people are going to forget them, they're going to break, etc. So we made sure that all of our facilities have a supply on hand, not to daily issue masks to everybody, but to have them there in those cases so we can ensure if people do forget them or break them, that we make sure that we can provide them as well.
Yeah, and that brings up a good question. I don't know if this goes to Dr. Koziak or you, Christine, but masks. There's so many kinds of masks. I found out that I bought a useless mask, I believe is called a KN95 versus an N95. And same thing with the disposable masks that we tend to hold on to for a very long period of time. And frankly, I have no idea if that's a smart move or a bad move. But considering everything in short supply, I'd love to discuss KN95, N95, surgical masks, and fabric masks, and how they all interact. And I'll leave it for anybody.
I wish that the question was coming. I have a display of all of them right off to the side. I can sneak away for a second and grab them when someone else is talking. So your KN95 mask, you're saying doesn't work because it has a valve on it. Is that what you're talking about?
I was told. I have no idea.
Okay. So the N95 masks, the health grade masks, or those that you've used in the workshop, work perfectly fine, just like a face covering, just like a cloth mask. They all work really well, in some cases a little better than others, to prevent both the inhalation of virus and the exhalation of virus into you. Right. The standard surgical masks that you see were designed to keep things in. So as a surgeon, you would wear that, or someone in the operating room, you would wear that in case you were sick. You didn't want to expose your germs into the open environment. Obviously, because it has some protection for you from stuff coming into you as well. But again, designed more to keep things in than out. The N95 mask is the opposite. The N95 mask was designed to keep things out. So I wear it if I'm in a room that has tuberculosis or other infectious diseases to keep things out. Obviously, it does a good job of keeping things in. The controversy with the N95s or K95 masks are that some of them have a valve on them. Those were designed, in the healthcare environment, they don't have a valve on them because I'm in a non-COVID world, I would wear them for a few minutes when I went into the room, take it off, throw it away, it's a disposable item. In a COVID world, I now wear it for 12 hours during an entire shift, which is why you see people with the pictures of their skin breaking down.
Yep.
It gets really hot and sweaty and barrier.
Especially
When I
if
would
you got
use them,
facial hair.
right. So when I would use them in the workplace, like the wood shop or a painting shop, they made a valve for them. That would allow some of that moisture to escape. It would be a little bit more comfortable. And if you see the difference, and I'll go grab them in a second, you'll see that the one design with the valve has a nice plastic rim around its nose. It's really comfortable to wear for long periods of time. The challenge with it is because it has a valve, when I cough or sneeze, it shoots things out into the atmosphere as designed, right? So it does a great job of protecting you. It just doesn't protect the other people as well as it can. It doesn't mean you should throw those away. In fact, that's a really great mask. All you have to do in order to use that to keep everybody safe is to wear a simple face covering over the top of your mask that has a valve on it. Covering the valve will then defeat what the valve would do. It still allows you to have a little bit better moisture barrier on the inside of the mask, but will prevent the valve from shooting the spray everywhere if you happen to cough or sneeze. So that's usually the controversy we see between those K95 masks and the clinical grade N95 masks. And then back to the simple face mask, the cloth masks or the barriers. They all do a good job of preventing exposure to viral load. None of them are 100%, particularly as we talked about before. If you're wearing it below your nose or off to your side or constantly pulling it down, then you're defeating the purpose of wearing the mask in the first place. So when you're in a common area, you put the mask on. And when you're having conversations, you keep the mask on. And then when you go back to your office, you can take your mask off and make sure that you're, using the earpieces or pulling it down and setting it nicely on the desk and not touching the outside of the mask. Again,
I keep mine in a plastic bag to keep it preserved.
Smart.
Correct. So the outside of the mask is going to, if there was some contaminant, would contain it. So grabbing it and holding it and pulling it down and off may cause something to get on your hands, which means, again, when you take off your mask, if you can, you should use some hand sanitizer and wipe and then work the rest of the day. And then when you leave the office, put your mask back on and everybody's happy.
Yeah, I think down the road, we're going to start having displays of all of the masks so people can know what choices they have. No, thank you so much.
Right.
That's a great one.
What mood you're in, perhaps, based off the.
I'm pretty sure the fashion industry will catch up with all of this stuff in the future.
Correct. And
we'll all get all kinds of, yeah.
We're seeing these neck scarves now that are very fashionable that have a mask that pulls up. Those will work okay in the work environment if you're interested in those. Again, it has the cloth barrier if you put it over your mouth and nose. If you're making masks at home and you have if you have the knowledge and skill to make them, a simple a technique to make it fit over your nose better is just to put in like a bread tie or something and sew it into that so it has a little bit of rigidity at the top of the nose so you can form it around your nose a little bit. And that will then prevent it sometimes from sliding down. It just needs a little something to rest against.
No,
but I'll go grab a couple examples here in a second.
No, excellent. Christine, one question for you. What changes have you guys made to accommodate the stay-at-home restrictions? And what are you guys planning to do to transition from stay-at-home to getting people back to work at Lytles?
Yeah. So while it may not be the standard across the board, my experience has been that our companies become even more open to the concept of teleworking. Not that we didn't have it before. Very flexible company. There were definitely a high number of individuals that teleworked. I wouldn't say as many on a full-time basis, but this has really opened the eyes of managers who thought they couldn't make this work before. A lot of managers were very adamant that teleworking wasn't an option in a lot of roles. And so now they've changed their thought on that. I won't say across the board, but they've definitely become more open to it and understand this could be possibly a longer term solution as well. So I've personally seen, and I've also heard a lot of success stories, roles which were nearly 100% in Leidos facilities pre-COVID, and then throughout have now turned into, maybe not necessarily 100%, but pretty close to 100% virtual in the current environment. So it's really forced people to be more open-minded, and you have to be more agile than we're used to being, right? So making decisions more quickly. I'm seeing, policy changes being turned around a lot faster than I could have imagined. So we're just moving at an overall faster pace. But we have to remember it's an adjustment for managers and employees and companies all together, right? So people make the assumption that everyone wants to telework, and that's not always the case. You have a lot of employees that really miss that interaction, just the social aspect of it, the challenges people face at home. So it's, it's an adjustment for everyone. But we also have to remember on the flip side, the many benefits we have to teleworking. So we've seen an increased quality of life for our employees. We were talking a little bit before about, the mental aspect. People are so focused on the physical aspects of possibly contracting the virus that we forget the mental effects this has had on people, right? So we have to think about the different ways that we can increase the benefits for health and wellness that we offer to people. There's fewer interruptions to people throughout the day. Sometimes, if you have young children at home, maybe not so much, but, this has also allowed people to be more effective throughout the day. There's cost savings for managers and employees. Business continuity becomes easier, and even it's better for the environment, right? So there's a lot of the benefits that we think about. But as we have to talk about accommodating stay-at-home restrictions and whether maybe this will continue and become normal work schedules, in many cases it will. I think a lot of managers are going to reevaluate and say, how did this work during this time? Could jobs that were previously in the office full-time now become partial or for full-time telecommuting as well? So managers have really been forced to be reactive, which is not what we want them to be, right? It's not how we normally operate. So we talk about, I mentioned being agile. With that comes flexibility to adapt quickly and be creative. So flexible work design, that's another key component as we operate under stay-at-home restrictions in some areas and some that have been lifted in others. But we have to really encourage that we're not going to be able to do things the way we did them before. So sometimes accommodations may work longer term. So we have to really arm our managers and human resources business partners with guidance on how to address the many questions and issues and concerns that are going to come up. So we've provided with our employees that are teleworking a lot of different resources. So, when this first started, is just how do I manage in a virtual environment? This is new. What is this going to look like for me? The health and wellness tips of managing through that. We talked, I think it may have been before the call, just what a great job IT across many companies are doing in handling this transition to a majority remote workforce. How do people collaborate when they're working virtually? Just some basic do's and don'ts, believe it or not, that people need to think about as they're working remotely, and even workplace etiquette. So we're focusing on that too, because we understand when we start to phase in people back into the office, it's not going to stop. We're not just going to be back to normal in a couple of months. So we really need to focus on, you felt like this was an emergency temporary situation, but it may become longer term in other ones. So we have to keep in mind, especially for those people where it was new, how do we help them continue to adjust? And then the flexible work design that I mentioned. So it's not just schedule flexibility, but workplace flexibility too. But some of the things that we're seeing, because when you hear flexibility, a lot of us think about your typical 980 work schedule, right? But there's a lot of different things that we're doing too, is alternating weeks. Maybe you're in week 1, I'm in week 2, or alternating days of the week where we don't have a large population in the office at the same time. You're working a partial day at home, partial day in the office, only coming in for key meetings or required in-person collaboration sessions. So a lot of these options are not only going to work in the current environment, but may be conducive to long-term situations, and companies just really need to be flexible.
No, I think that's fantastic. Thank you, Christine. Flexibility sounds like is the key word right there. Harry, when it comes to space and work, I've got one question about tenants' responsibilities to reopen their offices and common area management. What do you guys have as input on that when it comes from JLL and how you guys are interacting with your tenants?
Well, there are a couple different issues regarding that. So common areas for Leidos at their corporate headquarters is basically going to be driven by Leidos and how they act. But for many tenants, most tenants in Reston, most tenants across the country, they're in office buildings with other tenants managed by landlords. So there is a requirement to make sure that the landlord is first of all, an understanding as to how the landlord's going to manage that building, what policies are going to be put in place, how we talked about queuing for elevators, elevator status, access from the garage to the building, basically touchless doors. I mean, what kind of changes are going to be made to make the common areas of the building safer? And then you get into maintenance issues. We were talking, Christine mentioned, deep cleaning issues. I mentioned it earlier as well. That's driven by landlords. So those janitorial scope, that janitorial scope probably has to change. It's got to be modified to make sure that that tenants in buildings are safer. And how they're going to administer this. So a building that does not have a lobby attendant now have one to make sure that the queuing issues are done appropriately. Access to elevators is adhered to. There's a big responsibility on landlords for buildings that are multi-tenanted, and making sure that there are policies in place, written policies in place that can be distributed and managed consistently amongst the tenant base is going to be a critical component.
So if I'm a tenant in a building, I should reach out to my landlord if they haven't reached out to me to tell me what they're going to be doing.
Absolutely.
Now that's within my right. No, that's
yes,
excellent.
it is. Yes, it is.
Dr. Koziak, I think I saw you get back. I'm going to have you display the masks, but I am going to ask one question that was asked by one of our listeners about the thoughts about contract tracing and the employees' responsibilities and how the employees feel about that. But I'll let you display the masks first. Let's start with that one.
Let's start with contact tracing, and then we'll switch over to showing different face covering. Contact tracing is a responsibility of everyone to keep a safe environment. So that includes our employee base. I can speak to what is going on at Leidos, but I can also tell you what many other companies are doing. Certainly they're keeping your protected health information and your personal information as secure as possible in order to do that event. So when they know that there is something that has taken place, they will notify, the individual generally will notify HR through some kind of internal mechanism. We have one at Leidos, other companies have their own. And then from there, HR will do a detailed questionnaire about who they might have been in contact with in the building. We've had experiences of our own employees. We've had experiences of our employees exposed to subcontractors or other tenants in a building. And so that contact tracing gets a little bit more interesting when you have to cross over companies, as an example, or governmental agencies with private industry agencies. But for the most part, people have been pretty accommodating to them. I think what gets, where you see some variability is in what does it mean if I was a personal contact versus a close contact versus a presumed positive. And that's where I think there's a lack of standardization. So as an example, if in one company or one customer base, it might be if Joey's my partner and Joey came to work and he was sick yesterday and now is positive, I would therefore now, because I was in the social distancing bubble, I would now be a personal contact or close personal contact. I should likely go home. In some places, that's as far as you go with contract tracing. In other places, not only now was I sick and I'm a person of interest, even though I don't have any symptoms right now, everybody that I may have seen in the last 10 days also is supposed to go home. And then anyone they have seen.
Exactly.
Chain game, and you don't really know where to stop that. And so it really comes down to the definitions of, am I a presumed positive? And if so, then it's the close contacts next to me that I have to worry about. If I'm just a person of interest, then maybe the close contacts that I've had exposure to are less. If that makes sense.
I'm looking forward to the masks. So let's go ahead and get started because we're running out of time.
Simple bandana, pretty easy. Cloth mask that you've probably made at home of some form or fashion. Again, ideally it covers the nose and mouth. Pretty simple.
With the wire at the top to help rest the nose.
Yeah, I like that idea. Top, if you can put it in, I have an example of that. The standard surgical mask that we've seen and bought for years. helpful hint, they do have that metal bar at the top, so that tells you which way is the top. Sometimes you'll see people wearing them upside down. Again, we want to put it over the bridge of our nose and make a tight fit. These are the different varieties of N95 mask. So this blue one, or teal blue, is the medical grade mask. This one is bought at a hardware store for painting purposes. They're both the same kind of material. They both do the same kinds of things. I'm sure this one was 10 times more because it's medical grade in cost. You can see that maybe there's a little bit of difference, but in itself, they're not that different. You had talked about these ones that you wear in the shop. They have some ability to block out oil. You can see they're a little bit more comfortable. Look at the nice big fancy nose
exactly,
compared to these ones that weren't really designed for long-term use. Again, this has a valve. This has great protection, just like the N95 mask, so don't throw them away if you have them. But when you wear them, all you got to do is cover up that valve with either your cloth or your bandana or whatever, and now you've maximized your personal protection. And by covering the valve, you've maximized the protection you can give to others. So it's probably the best of both worlds as long as you cover up that valve.
Awesome. Well, I'm going to be coming over to your house because you definitely have way too many masks, Dr.
And then if you really want to have a papper, this is what a papper is.
There you go. Maximum protection.
Maximum protection. I am a practicing clinician, so this is why I do have these. I'm not hoarding them in any way. I have to wear them.
Well, I'm still coming over. It doesn't matter. You got way too many. I counted like 9 already. Okay, any last remarks? Please try to keep them, everybody, down to like, 60 seconds or less so we can wrap up. Harry, I'm going to start with you, and then Christine and Dr. Koziak.
I think the only thing I would like to impress upon the participants and attendees is that this is a very individual decision for each company, and you can't be too prepared. So you'll have to do what makes sense for your companies and your workers. You might be fine working remotely for a period of time, or you might find that you need to be back to collaborate, to create culture, and to do those things you need to do in the office. And if so, do it carefully. If you're in a multi-tenant building, like most tenants in our market, make sure you coordinate with your landlord. Excellent. And make sure the policies are in writing and presented to you.
Thank you so much, Harry. Christine, any takeaways?
Oh, sorry, I had you on mute. I apologize. Yeah, just one final comment. At the end of the day, our focus is doing everything we possibly can to make the workplace safe for our employees. But it's a joint effort, right? So we even have our employees doing pre-screening checklists before they come into the office. So there's some ownership there on the employees to make sure they're healthy enough to come back into the office, arming themselves with face coverings. And then we have a large team of people making sure our office is safe and recognizing this is an ongoing effort, right? There's nothing is one and done. So we have to continue to be vigilant, I apologize, throughout this upcoming however many months it's going to be.
Excellent. Thank you,
Thanks.
Dr. Koziak. Any final thoughts?
Yeah, thanks for having us here. I want to echo that this is going to be a longitudinal journey that will have many ups and downs. It will likely take a couple steps forward and then a couple steps back and a couple steps forward as we figure out what new normal looks like. So being flexible and patient. Today is June 9th. What we tell you on June 10th may be different than what we discussed today based on the science. And I would try to remind people that December 2019 was the first we'd ever heard of this virus. And the fact that we're talking about a vaccine in a year is faster than we've ever done it before. The fastest we've ever done it in the past is 4 years. So imagine what the science is doing to cut it down into 12 to 18 months. And that means everything has to go right. It also means that we have to be very diligent on following the guidelines. And for companies like Leidos that function in almost all 50 states and 20 countries, you're kind of stuck with following the local rules, and the rules are different from county to county and state to state. So we'll continue to be flexible is my phrase for the day.
Excellent. Thank you, Dr. Koziak. Charles, take us home.
Great. Thank you, Joey. Thank you, Dr. Koziak, Christine, Harry, for your engagement, for contributing to such a robust discussion this morning. Thank you to everyone for attending this morning. Obviously, with everything that's going on in the week, whether you're back in your office or not, we know that your time is precious. So making the investment to join us this morning for this presentation from the staff and I here at the Greater Reston Chamber for our panelists, we definitely appreciate it.